Today's guest might just blow your mind. She's talking about something that so few people talk about, and it can be a real game changer for people who are stuck in health struggles and they just can't figure it out. Her name is Dr. Christy Sutton, and she talks about a topic called iron overload. So people often are worried about having not enough iron. Well, today, we're going to talk about what happens when there's too much in your system and how often it goes undiagnosed. So before we do that, of course, what do? We want to thank a few of our sponsors. We're going to do that next. I want to thank you guys for being here as always and for being such amazing listeners. Please keep the comments coming, whether it's on YouTube or on Instagram. You know where to find me there. It's at Nathalie Niddam on Instagram. If you're feeling like you want to visually connect with me and my guests, then you just want to head over to YouTube and look me up, and all the podcasts are there. And of course, if you want to connect live and in living color with me, doing weekly live Q&As with some of my podcast guests and connecting with other amazing like-minded people just like you can head over to natniddam.com, look up the tab community, and you'll learn all about my membership community there. Or if you're not quite ready to get that up close and personal, then maybe sign up for the newsletter. We write lots of amazing things in there, talk about biohacks I'm loving. We talk a little bit about episodes, and we even have a peptide-specific newsletter if that's your jam. All right. Today's episode could change the way you look at fatigue, joint pain, hormone imbalances, or even anxiety. Dr. Christy Sutton joins us to talk about a condition that's often misdiagnosed or completely missed: hereditary hemochromatosis, an iron overload disorder that can silently damage organs for years before it's caught. It also silently damages joints. By the way, I had a neighbor who suffered from hemochromatosis. Dr. Sutton shares her powerful personal journey, helping her husband navigate years of confusing symptoms, multiple misdiagnoses, including one as serious as autoimmune hepatitis, and ultimately uncovering not just iron overload, but a pituitary tumor she believes may have been connected to the condition in the first place. We get into why so many people live with high iron levels without knowing it, how genetics and lifestyle both play a role, and the steps you can take to get clarity and protect your long-term health. This conversation is packed with actionable insights and may help you or someone you love finally connect the dots. Check out Dr. Sutton's book, The Iron Curse, and if you want to check out her courses, there's a link in the show notes just for that purpose. Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Welcome to the show, Dr. Christy Sutton. It is a pleasure to have you here today.
Thanks for having me.
Yeah, well, I'm excited. Your book, The Iron Curse, first of all, best name ever, best title ever. The cover, like, it looks like one of these thrillers. It's a great looking book. And frankly, it kind of is, right? Because the topic at hand is, it's dramatic, I think. And it's something that a lot of people don't talk about. And although I don't always ask people, so how did you come to doing what you do? You have such an incredible origin story around this whole issue of iron and the damage it can do to a person with your husband and his journey. Maybe we can start there, because I think what's fascinating about it and what'll hopefully really catch people's attention is that these symptoms of iron overload can be so amorphous. They can cross over with so many different things. And I know that, this is what today you probably would have figured it out much faster, but at the time it was new to you, right? So maybe talk a little bit about that journey.
Yeah. So, my husband has hereditary hemochromatosis. And he got diagnosed because of the legwork that I kind of forced him to do, as far as going to the right doctors and being really proactive about asking the right questions. And it was a journey, certainly. He was I don't know exactly when he started developing hemochromatosis. He has a couple hemochromatosis genes. So I don't know exactly when this process started as far as him going too high in iron, but I know the first time I saw his labs after we got married, he did have some abnormal lab findings that immediately made me think, oh, you need to donate blood. At the time, I didn't know that he had the hemochromatosis genes. I figured that out later just by doing a 23andMe, or I figured out he had one of the hemochromatosis genes by doing a 23andMe, and then later found out he had a second hemochromatosis gene. And basically, his liver enzymes were becoming elevated because of the iron, because iron is very toxic to the liver. I mean, it's toxic to the whole body, but often one of the early flags on labs, not for everybody, but one of the early flags is high liver enzymes.
Sorry, I'm going to
Go ahead.
interrupt here because it's a bit of a paradox, right? Because when you have low iron, what do you eat?
Red meat.
You eat liver,
Oh, right, right, right. Yeah.
right? Like liver is a great source of iron. So it's so interesting that, and I mean, it makes sense that iron clearly has a sweet spot. You want to be right where you need to be. So I
Mm-hmm.
interrupted you. I apologize, but I'm just like, oh my God, that's crazy. Like liver, like iron's toxic to the liver. And yet when we're low in iron, we get told eat liver.
Okay, so to make sense of that,
Yeah.
where iron is stored largely in the body is in the liver.
Okay.
Okay, and so the iron is stored in the body, and iron is a very caustic, reactive, in high doses, like necessary for health
Hmm.
and survival, but also double-edged sword, can oxidize and destroy and create inflammation and damage. And
Right.
so the parts of the body that store the iron more than other parts tend to get more damaged.
Right.
And the liver is one of the first early on and most significant storage units for iron. And the body knows that we need iron, and so it stores it away for like a rainy day, a famine, where we have to go and deplete our iron levels from our liver storage. Um, just like the liver stores triglycerides for a
Hmm.
famine. So
Hmm.
it's like this big storage unit. And the liver has a lot of protective mechanisms to help deal with all of, the iron that is in there. Um, it creates a lot of glutathione to help decrease the damage from the iron. Having said that, the more iron that accumulates in your body, the more it stores in your liver.
Hmm.
And then that iron can eventually damage the liver so that it'll increase the risk for basically all liver diseases, not just liver inflammation and fatty liver and cirrhosis, but a 200 times increased risk for actually liver cancer in people
Wow.
that have hereditary hemochromatosis that is
Wow. Wow.
undiagnosed and untreated. Um, and this is horrible because we're talking about a condition that is really easy to diagnose and treat.
If you know where to look. So with your husband, sorry, I
It's
interrupted you.
okay.
So with your husband, his liver enzymes were high, and you were already saying, you probably should give some blood, but you
Yeah,
hadn't quite put two and two together yet.
right. So he had high liver enzymes. He also had some of his red blood cells and hematocrit and hemoglobin were slightly elevated, which can happen with high iron. And when you have high red blood cells and hematocrit and hemoglobin, then your blood gets thicker, which increases the risk for
Right.
like clotting, which is very dangerous. My husband never had a clot, but this is another important finding that just completely got um, dismissed and ignored by his doctor that ordered the
Hmm.
labs, his primary care doctor. And then his doctor did order a ferritin, which is a stored iron marker,
Yeah.
and his ferritin was elevated as well. I can't remember the exact numbers. I want to say it was like 300 or 400, which is high enough that anybody should be saying something. But nobody was saying anything other than his chiropractor wife, who he loves more than he listens to. You know how that goes. So,
Mhm.
but he would donate blood periodically, and not as often as he really should. And he and I didn't understand at the time how important it was to really have this managed chronically for the rest of your life, because I didn't understand he had the hemochromatosis genes. Now, I realized that during the process of writing my first book, the genetic testing book, and creating the genetic detoxification report, I realized, oh, my husband has one hemochromatosis gene. Because at that point in time, I was really just looking at the two main hemochromatosis genes.
Yeah.
And then we go through the process of getting him, um, he goes to a gastroenterologist, which gastroenterologists should be able to diagnose and treat this properly. And I give the gastroenterologist the labs that we had ordered and his doctor had ordered, and the genes, and his gastroenterologist really dismisses it and goes down this rabbit hole that misdiagnoses my husband with autoimmune
Right.
hepatitis. Okay.
Right. I remember this part.
Yeah.
Yeah, yeah, yeah.
So then we only get out of that rabbit hole because I went outside of the gastroenterologist's office, and I ordered more labs myself to see if the medication they put him on was working, because
Mhm.
the doctor said he would not recheck the markers for autoimmune hepatitis for a year.
Yeah,
Because
that's what you said in the book. I was like, a year, like so much can happen in a year.
yeah, and his reasoning was because it takes like a year for it to work for the
Okay.
um I forget the name of the drug. I want to say it's like uracil or something. Anyways, it's commonly given for autoimmune hepatitis. So my husband's on this drug for a couple months. He's not feeling better, and in certain ways he's feeling worse. So I do more
Mhm.
labs, and it shows that his iron levels are getting higher, his liver enzymes are getting higher. And when I rechecked the antibody, it's called the smooth muscle antibodies.
Mhm.
That's the diagnostic test for autoimmune hepatitis. Those were negative. And so I give this to the doctor, and he's like, oh, it was a misdiagnosis. It's not autoimmune hepatitis. It's polycythemia vera is what he's thinking it is. And polycythemia vera is a condition that causes high red blood cells, and you just have to have blood removed, but it's a genetic condition. So he sends my husband to the hematologist. This is the same. I go to the hematologist with my husband, give him all the labs, give him the genes, and the hematologist is like, oh, this is easy. Hereditary hemochromatosis.
Oh,
They
okay.
redo the hemochromatosis genes, and at that point in time, they were just checking for 2 out of the 3 genes. And so they say, okay, you have one hemochromatosis gene, you have high ferritin, high iron saturation, you have hereditary hemochromatosis. We're going to work to fix this, and it's going to make everything better, because he was also suffering with the other common side effects, which is like fatigue, low testosterone, and he had some high cortisol, high DHEA, which can happen due to the stress of just hemochromatosis. Everybody's
Okay.
different. So,
Yeah, I was going to ask. So I have a couple of questions
yeah.
just to back up a little bit. What are the 3 genes? Are
Okay.
they HLA genes or what's the
No, they're HFE genes. So
FFE?
they
Okay,
all
sorry.
start with HFE. And um, HFE C282Y is the most significant, because that's the one that causes the highest risk for hemochromatosis, because that's the gene that increases iron absorption the most out of the 3,
Mm-hmm.
although all 3 of them do increase iron absorption. The second gene is called HFE H63D, and that's the most common one to have. And it does increase your risk for hemochromatosis. My husband has one of those. And then the third gene, which is definitely significant, but only being added to hemochromatosis panels like within the last couple of years, is HFE S65C. And so we only figured out my husband had that one because I reran his 23andMe raw data through the genetic detoxification program that I created after I added
Mm-hmm.
that gene, because not all genetic reports include that. So I figured out, okay, my husband actually does have this third one that just wasn't being looked at. He inherited one from both his dad and his mom.
Oh, wow.
Yeah.
So does he have family members that present with hemochromatosis? Because it is possible to have one gene and have not store excess iron, right? Which
Yeah.
is fundamentally what hemochromatosis is. Maybe we should have started there
Yeah.
to
Backing up.
define to the
Yeah.
audience exactly
Yeah.
what is this crazy big word.
Yeah, so hemochromatosis is just where you have too much iron. And it
Yeah.
can be, most commonly, it's because you have this gene, one of the genes that increases iron absorption. You can have non-hereditary hemochromatosis, which is where you don't have the gene, but you still have high iron on your labs. And like basically you have high iron saturation and high ferritin. And if you have the high iron saturation plus the high ferritin, plus a hemochromatosis gene, that's hereditary hemochromatosis.
Okay.
If you have the high iron saturation and the high ferritin without the hemochromatosis gene, that's non-hereditary hemochromatosis.
And so how does that happen? So, but you don't have the gene, you're just storing too much iron. Is that then related to lifestyle and diet somehow?
Yeah.
Okay.
So the people
there are
that
two kind of one of them it's almost like the hypercholesteremia, right? Like there aren't nearly as many people that have it who think they have it, but someone whose body just overproduces cholesterol from a genetic programming perspective versus people who have high cholesterol, of which there are legions because of crappy diet and lifestyle choices.
Right.
Okay.
Yeah, 100%. So the people that I see most commonly that have non-hereditary hemochromatosis are largely men that are on the carnivore diet.
Oh, interesting.
Because when you eat a carnivore diet, you're getting a lot of very absorbable iron.
Mm-hmm. Sure.
And so, and the people who I see now, if you have a hemochromatosis gene and you get on a carnivore diet, then you're much more likely to become high in iron.
Sure. Well, because your body's efficient at storing it away.
At absorbing, you absorb more iron, and then everybody's pretty good at storing it for the most part. It's just some people are better at absorbing it. Yeah.
Okay.
So
yeah.
So okay. So I'm with my husband at the hematologist office, and we get him properly diagnosed, and we're kind of expecting like everything is going to get better. And most things do get better. But one lab that I had been checking on him that hadn't been checked outside of his regular doctors was DHEA and cortisol, which are like adrenal stress hormones. And they would periodically go slightly high and then go back down. And that lab did not get better when my husband was treated for the hemochromatosis. Everything else got better, but that. And so then we go to the endocrinologist and we find out that my husband has Cushing's disease, which, let me explain what Cushing's disease is. So Cushing's disease is where you're making too much cortisol. And my husband was making too much cortisol because he had a tumor on his pituitary gland that would tell his adrenal glands to make too much to make excessive amount of cortisol. And so he developed high levels of cortisol for a long period of time. And it was not like your typical presentation. Usually people that have high cortisol, they'll get like real puffy in the face and a lot of weight gain around the belly, and they'll get like high blood sugar and high blood pressure. My husband didn't check all those boxes, and so he was less likely to get diagnosed without me doing all these extra tests. And even at that first appointment with the endocrinologist, I gave the endocrinologist, my opinion and ended my summary with, I think he might have Cushing's disease. And she said, no, he doesn't have Cushing's disease because his blood sugar is normal. And then 6 months later, we're having brain surgery to have the tumor removed. And then 5 years later, they go in and try to remove the rest of it because the first surgery did not get all of it out. And so now we think we got it all out, and he's doing much better. Now, the reason I included that part of the story is because, in my opinion, I don't have any way to prove this, but I've done a lot of research on hemochromatosis. And one thing that I have learned in this process is that when you have high levels of iron in hemochromatosis, the iron likes to affect certain parts of the body. And one part that it likes to really affect is not just the liver, but also the pituitary gland, and specifically the anterior pituitary gland. So there's an anterior and a posterior pituitary gland. And high iron really affects the anterior pituitary gland, which is where my husband's tumor was. And so I believe that my husband had high levels of iron in his pituitary gland, lots of oxidative stress, low antioxidants. All of this happened in college. His health dramatically changed in college. He gained all this weight. He had this anxiety attack. He was also in college, eating like crap. Wasn't exercising as much as he had been before. My husband was a very good athlete in high school, probably would have excelled past high school had he not had an injury that wasn't correctly fixed, a groin injury. And so I say that because when you're exercising a lot, it's easier to keep your iron levels down.
And then athletes are prone to anemia, right? Because of bursting red blood cells. And
yes, because there's so many different events that are happening with exercise, and they often lead to low iron and low red blood cells and anemia. And so when you are exercising a lot and you have one of these hemochromatosis genes, you're less likely to get low in iron. And that's advantageous during that period of time where you're exercising a lot. Well, then you stop exercising and you go to college and you're eating horrible and you're, just flooding your body with toxic food. Well, then you get more free radicals, damage, DNA damage causes cancer. So, and iron causes free radicals, and the free radicals cause DNA damage, and DNA damage causes cancer. So I believe when my husband had, all this weight gain and anxiety in college, that tumor started growing, and then he had to actually drop out of school. He was going to A&M, come back home to Dallas, and they just said you have anxiety and didn't correctly diagnose it. Now, my husband doesn't have anxiety anymore now that the tumor's gone. But he did have anxiety while he had that tumor.
Right.
Does that make sense?
Well, I mean, the pituitary tumor is going to, the pituitary gland is so critical to hormones.
Yes, and that's one reason.
Body, that's bound to, as you said, excess cortisol, chronically elevated cortisol, that's probably going to drive anxiety.
Yes, 100%. Having said that, I know for sure his anxiety was tied to the high cortisol, because as soon as that cortisol level was fixed, the anxiety went away. And that was really the only thing. And the anxiety started at the same time as the weight gain, which cortisol causes weight gain too. Now, we've had this conversation with his doctors, and they all say that tumor did not cause anxiety. So do we believe
because
them?
They might be thinking of it mechanistically, but I mean, if you look at it on a downstream effect.
Yeah, I think it's just one thing I've learned through my process of everything I've gone through myself and with my husband is that there's a lot that we don't know and understand about the body, that sometimes, we go to doctors and we expect them to know, and they just don't know. And so sometimes they give us the wrong information. Yeah. And I think that was one example of that. So, so my husband,
Cushing's disease. Yeah. So he was diagnosed with Cushing's disease.
Yeah. So he was diagnosed with Cushing's disease. Now he's better from that. And we're hopefully kind of have that chapter behind us, which we're still kind of in the healing from the surgery phase, but have that chapter behind us. But I realized after walking my husband through this experience, in my own patient population, there were so many people that have hereditary hemochromatosis. And I realized this is a very common gene that most people don't know they have. And this is creating like generational health problems that look different in every generation, but it's all the same root cause, whether it's
Wow.
joint pain, diabetes, heart disease, dementia. And I realized like looking at these specific genes, not just in isolation, but also in combination with other genes, it's a really powerful way to predict health problems. And then if you can predict health problems, then you can kind of reverse engineer it to
Yeah.
create a personalized health plan.
Mm-hmm.
And so I realized there's an epidemic of undiagnosed hemochromatosis. And I'm a chiropractor in Dallas. And so it is within my scope of practice to diagnose hemochromatosis, but I cannot treat it. Like I cannot remove your blood from your vein, or even like sign a form to have therapeutic blood removal from the blood donation center. And so it put me in this situation where I would refer the patient to get treatment, and often they would not, because they would go to their primary care doctor and ask for a second opinion, and the primary care doctor would disagree with my opinion. They would say like, oh, your levels are fine, or oh, you only have one hemochromatosis gene. And what I realized was that there's a lot of myths and misperceptions about hemochromatosis, and the medical professionals are really lacking in their understanding of one, like how to diagnose it, what it does to the body, and the genetic predispositions that actually create this problem.
Yeah, no, that's pretty impressive. So, okay, so we know a bit about the genetic predispositions. We have any one or more of those three HFE genes will predispose the person to developing hemochromatosis. And
Yes.
so if you're double home, like if you have two genes, do you will that person definitely have hemochromatosis? Will they have it as a child? Does it get triggered by something as people get older? How does that?
Yeah. So, okay, this is where the genetics are important, and you need to know your genetics.
Mhm.
You need to know if you have one hemochromatosis gene, you need to know if you have two hemochromatosis genes. But the genetics themselves don't create 100% predictability. The
Mhm.
environmental factors are a part of this too.
Yeah.
Now, having said that, there are certain genetic combinations that, like, the chances are close to 100% that you're going to get hemochromatosis. So, for example, the worst gene, the hemochromatosis HFE C282Y, if you
Yeah.
inherit one of those from your mom and one of those from your dad, then you're, a homozygous C282Y. This is not a super common genetic combination because it can destroy your health at a young age even. And if you destroy your health at a young age, it's hard to reproduce and have more kids. But it is
Mhm.
out there, mostly in the Caucasian, largely United Kingdom Irish population, and those descendants that came to America. It's also Northern European. It's very common. If you have two of those, chances are very high you're going to get hemochromatosis. Okay.
Wow. Okay.
And it's going to be much worse, meaning it's going to be much harder to manage because you are so good at absorbing iron. And this is why it's so important for people to figure this out sooner rather than later, because if you learn about this early in your life, then you don't end up being like a 40 or 50 or 60 or 70-year-old person that now
Mhm.
has stored excessive amounts of iron for decades and your ferritin's in the thousands, and
Right.
then you have irreversible damage, and
Mhm.
it's a harder path to get down to a healthy iron level. It's much easier to prevent this problem in these people than to correct the damage and correct the problem.
Yeah. Yeah, well, and some of the damage is
Irreversible.
it's virtually irreversible. So maybe I'm trying to decide which fork in the road we take now. Do we talk about what are all the problems that excess iron can cause, and then yeah, let's do that. Let's, because I think there's some things here that people don't realize necessarily. I mean, I wrote out this list. And I mean, it's interesting that you mentioned oxidative stress. Like, people talk about virtually rusting from the inside from excess iron. Like, you're rusting.
Mm-hmm.
So the excess iron can chronic excess iron, right, can speed up aging and decrease life and health span. You talk in the book about how it increases autoimmunity, damage to the spleen, vision loss, hearing loss. The hearing loss is interesting because it seems to be related specifically to antibiotic use. You talk about gum disease. Hair loss is really interesting. I mean, it's all interesting. So do you want to maybe kind of run through some of these things and talk about how the iron is
Yeah.
is basically causing all these issues?
Okay. So, iron likes to store in certain body parts of the body more than
Right.
others. Having said that, eventually, if you're like really good at storing iron and really good at absorbing iron, then you kind of become like this iron hoarder, and you run out of like closets to put things in, and it just ends up overflowing to like your whole house. And then you're just a hoarder and it's everywhere, and it's really hard to live a healthy life that way. So, but the first places that iron likes to store in really are the liver. So, increased risk for liver cancer, cirrhosis, liver inflammation, fatty liver, liver enzymes being elevated. It likes to store in the intestinal lining, the lining of the intestinal cells. And so you get an increased risk for intestinal inflammation, leaky gut, autoimmune. A lot of these people have a lot of gut issues from all that iron storing in the intestinal, in the enterocytes.
Yeah.
It likes to store in your immune cells, like your spleen, and even in like the macrophages. And so you're more likely to have spleen problems. Interestingly enough, the people with non-hereditary hemochromatosis are more likely to have spleen issues than hereditary hemochromatosis. And that there's like a specific reason for that. That is, the people that have non-hereditary hemochromatosis make more hepcidin, which causes them to put more iron in their spleen. Hepcidin is like the braking mechanism for absorbing iron. And your liver makes this braking mechanism protein when your iron levels get high, so that you'll decrease iron absorption. And the people that have the hemochromatosis genes, they don't make hepcidin as well, so they don't have a good way to break down. They don't have a braking mechanism for absorbing iron, so they just keep absorbing more and more and more. They like, it's like the ability to control it is off. And so, because they don't make a lot of hepcidin, they don't store as much in their spleen. It's like reverse what you would expect. So iron also will largely store and damage the anterior pituitary gland. So the anterior pituitary gland has huge global effects on your health, because it makes thyroid stimulating hormone. So you can develop thyroid issues, not just because of pituitary issues, but high iron also damages the thyroid, making more of a Hashimoto's type issue, or just regular primary hypothyroidism. And anterior pituitary gland makes ACTH, which my husband made too much of, which causes high cortisol. Now, some people will not make enough ACTH, which causes low cortisol. My husband just made too much cortisol because he developed a tumor there. So you can have just low cortisol fatigue, low DHEA fatigue. This is really common with high iron. Anterior pituitary gland is important for growth. So if you develop hemochromatosis at a young age while you're still growing, you're more likely to have stunted growth. And this can and does happen in young kids. Like, my colleague's 5-year-old developed hereditary hemochromatosis. And if it hadn't been for her and I being on top of it, she would have not been diagnosed. Even getting her treated was almost impossible, The
Wow.
hematologist didn't want to have anything to do with it. It's a long story that I'm happy to go through at some point in time if we have
Well,
time.
because she's a child, because she's a girl, because they
Because
perceive it
she's
to
a
be dangerous.
5-year-old, because she was a 5-year-old, basically we made the diagnosis. Okay.
How did you even figure out there was something wrong?
Well, knowing there was something wrong was pretty easy. Her daughter stopped walking. She was 5 years old. She got a infection and she stopped walking. She completely neurologically deteriorated,
Wow.
and took her to the doctor. They started running tests. This is a very bright clinician. She's like, okay, I'm going to run some more tests myself to figure this out because it's my 5-year-old. I'm not going to
Hmm.
waste time. And so she carries her child to the lab testing company and runs like a lot of labs on her 5-year-old. And she calls me a couple hours later and she's like, I carried her in there and now she's running around normal. And I was like, she has hemochromatosis.
So that's just from the blood draws, just from
Yeah.
relieving the load, reducing the load of iron in her system.
Yeah. So for a 5-year-old, the amount of blood that was removed was significant enough to make a measurable effect. Now,
Wow.
a 40-year-old, that might not be enough blood to make a big enough difference, but
Hmm.
for a
Hmm.
5-year-old, it was enough to make her feel better that day. And so the labs came back. They confirmed she had hemochromatosis. You know, she had a couple of hemochromatosis genes. And she goes to the pediatrician. Pediatrician's like, we've never seen this before. It is hereditary hemochromatosis. They'll refer you to the hematologist. It takes months to get in with the hematologist because pediatric hematologists are really busy treating pediatric cancers.
Yeah.
And so the hemochromatosis situation is not like their bread and butter, or even in their opinion, like a priority to the cancer patients.
Hmm. Hmm.
And so, which is understandable, but still, I mean, that just is the reality. So in the interim, we put her on the supplement protocol to lower her iron because you can't just like have a 5-year-old donate blood. That's not even possible to have a 5-year-old donate blood outside of just lab work. So we put
Right.
her on the supplement protocol. She finally gets in with the hematologist, the pediatric hematologist. They do labs that day. They, listen to her, take the history. They say her labs are fine. She's fine. You don't need to be here. And take her off of those supplements. They're not doing anything. We'll recheck her labs in a little while. If they start coming up high, if the iron saturation goes over 45%, we'll start treating her then. So she takes her off the supplements. Iron saturation goes back up over 45%. She reaches out to the pediatric hematologist. I actually have this email in the book on juvenile hemochromatosis because it was shocking and disturbing to me. I didn't put the name of the doctor in there. I
No.
obviously crossed that
Yeah.
out because I'm not trying to get sued. But I felt like the story was important. And the pediatric hematologist nurse responded saying, basically, we're not interested in treating you. She's fine. This is a condition that affects men in their 50s. And go back to your primary pediatrician. And we don't know why she's tired. She's not anemic. And it was just totally, totally dismissive.
Wow.
So she was referred back to the doctor that referred her to the pediatric hematologist. And it has been so hard. She has had to work so hard to keep that girl's iron levels in a healthy range. And we're just like, please stop. Like, menstruate. Like, this was many years ago when this started. The ultimate help is going to be when she starts menstruating and losing
Hmm.
blood every month. That's going to pull her out of that hemochromatosis phase, hopefully, so that she will have decades of not having high levels of iron.
Wow.
And but then when she is postmenopausal, she can start donating blood and having blood removed, and hematologists will take her seriously because now she's not a child with hemochromatosis. It's the child situation that
That's
is like being exponentially more neglected than the adult situation. And the adult situation of neglect, or I think misdiagnosis, is horrible as well, especially because we're talking about a condition that is really easy to diagnose and treat. So
Yeah. Well, so in terms of, you said that she was on a supplement cocktail. What were the supplements
yeah,
what are the
okay.
supplements that are
So
helpful?
I have them in the book, but I might forget some, but this is
There's
what
a
I
lot of
remember.
them. Like I wrote some of them down, but there's
Yeah.
quite a lot.
So, but I mean, like in that story that I tell
Yeah.
for the specific person, I have the exact thing in there. But I remember we had to put her on a really high dose of a liquid turmeric.
Yeah.
Because you're talking about kids here, so liquids are really important.
Hmm.
And so the liquid turmeric, a very high dose, was crucial. And I think that was the most. There was another pill, I think. She got her child to swallow pills at a pretty young age. I think there was a turmeric pill that we put her on. I
Would it have
think
been like selenium or glutathione or?
I don't think we put her on selenium at that age. It's not a bad idea, especially because selenium binds to iron and it also helps heal up the liver. Like that is a
Yeah.
good supplement. But I feel like what I remember from that part is that it was really a large amount of curcumin that helped pull it down.
And what does the curcumin do? Does it bind it and move it out, or so it
Yeah,
literally
so the
binds it?
curcumin binds to the iron and then you cannot absorb it. So you can't absorb the iron. And then it's also like a natural anti-inflammatory. So
Yeah.
it helps with a lot of the symptoms while correcting the underlying problem of having too much iron.
So this is a complete sidebar. So when people cook with a lot of curcumin, are they binding the iron in their food and making it harder to absorb?
Yeah. Yeah. So definitely that's something that if you eat enough curcumin in your diet, that's going to decrease your iron absorption.
Hmm.
Just like if you
Interesting.
eat a lot of dairy, calcium rich, because calcium binds to iron too,
Yeah.
you're more likely to be low in iron. And this is one reason, like the dairy situation is one reason that so many young kids are low in iron because they're eating so much. An infant is just on calcium rich milk and
Cheese.
and
Yeah.
so and then they
Yeah.
you know they eat tons of dairy when they're young, and so that dairy, the calcium in the dairy binds to the iron and they become often low in iron.
Hmm. Interesting. Okay. Well, so that's a nutty story about a 5-year-old. That's
Yeah,
nuts.
yeah. So but that's just okay. So but I was going through all the health problems that high iron can cause.
Yeah.
So the anterior pituitary gland can also create issues with infertility and hormonal problems. So like AMH is a hormone that is really important for fertility and ovarian health. And do you have healthy eggs? And often women with hemochromatosis will have a low AMH, meaning like they're less fertile. Now, just because you have a low AMH doesn't mean you like can't get pregnant. It just means that you're less fertile than you otherwise would be.
Hmm.
Um, and then you'll have often abnormal or lower levels of follicle stimulating hormone and LH, which are important for making estrogen, progesterone, and testosterone. So, like in women, you'll see hormonal problems. In men, it's very common to see low testosterone. Um, and the problem here is that the men then go and get put on testosterone, and then the testosterone increases iron absorption
Hmm.
and
It
increases
makes
red
blood
blood cell
thicker too.
production.
Yeah.
And then they're going to have like even more high iron and more thick blood and more of a chance of dying of a heart attack,
Yeah.
which is something you see in a lot of people that take testosterone.
Hmm.
It's happening. And
Yeah.
the iron situation is not being looked at closely. So anybody that's taking testosterone needs to figure out, do they have high iron that's causing the low testosterone? And does the testosterone treatment cause them to become high in iron? Okay. So,
Right. So you want to make sure that it's, because I know that a man on TRT, on testosterone therapy, they're doing regular blood work like every 3 months to check exactly what you're talking about. Like the blood's not getting too thick, that there's not too many red blood cells.
yeah.
Like,
Well, they check the red blood cells and the hemoglobin and hematocrit, but they don't hardly ever check like the ferritin and the iron
mhm.
saturation and the iron labs.
Yeah.
They're not looking at that. and they
Yeah.
should be. But they at least need to be looking at the hemoglobin, red blood cells, and hematocrit. And, that's essential. Yeah.
Yeah. 100%.
Okay, so
Okay.
other issues that I'll just go through this real fast. Other issues that high iron can cause is it'll affect your brain, causing like increased risk for dementia, Alzheimer's, Parkinson's, bipolar, depression,
Yeah.
you name it, poor cognitive health. It'll go to the heart, creating heart disease, high heart rate, high resting heart rate, low heart rate variability, more likely to stroke, have plaquing. It'll cause joint pain. It'll cause high uric acid, which creates, gout type issues. It will cause your pancreas to be destroyed, causing diabetes.
Yeah.
Um, it it increases the risk of cancer everywhere, skin cancer. It really it can affect every cell in your body. Some cells more than others.
Yeah. So that's crazy. Like, so let's so what are the things that people are most likely to feel? Is it the joint pain? You also talk about hair loss in the book,
Yeah,
and vision loss, and even affecting hearing. Now the hearing, interestingly enough, you in the book you talk about how actually it's related to antibiotic use, and it's somehow the antibiotic that drives the issue with the iron, with the excess storage of iron.
no,
Oh,
so
absorption, sorry, not
yeah,
storage.
so if you have a lot of iron and then you add specific antibiotics to the equation,
Right.
you're more
Okay.
likely to have the hearing loss because the iron has already like damaged the cilia in your ears. And so it what's really creating the problem is the high iron, and then the antibiotic is just like flipping the switch that can cause
Mm,
specific hearing loss.
crazy.
Um, and then the hair loss, a lot of people think of hair loss being a low iron issue, which it can be, but high iron can cause hair loss too because it can like kill the hair follicles basically. And then the hair falls out. And then also, high iron will decrease nitric oxide. And so, nitric oxide will is important for blood flow to your whole body, including
Hmm.
like your hair and your brain and your heart. So you're more likely to, sometimes people will have hair loss just because like they don't have enough circulation to
Yes.
their hair,
Yeah.
or the rest of their body. Or sometimes people have hair loss because they don't make enough hormones to,
Hmm.
whether it's
Hmm.
testosterone or if it's progesterone or if it's thyroid, so it can be, the hair loss can be from a lot of different issues, but
Yeah.
it is something that we need to at least be aware of as an issue from
As a
hemochromatosis.
possibility. But the big one I've heard of is the joint pain. And I mean, the brain neurodegenerative issues, that's really interesting because you talk in the book about how the iron will affect the brain structures that are outside of the blood brain barrier and the basal ganglia, which has a very direct relationship to Parkinson's disease, for example.
Yeah, so the basal ganglia is hit really hard because the basal ganglia really uses a lot of iron to make dopamine.
Yeah.
And so there's a little bit of like a Goldilocks principle. Like if you're low in iron, your basal ganglia may not make enough dopamine. And that can look like, poor impulse control, poor ability to focus.
Hmm.
Um, Whereas if you have too much iron, the basal ganglia, you're basically creating a lot of oxidative stress in the basal ganglia, and that will kind of burn up and destroy those dopamine producing cells.
Hmm.
Um, which the other part of that, if we're really going to talk about like Parkinson's, because Parkinson's affects the basal ganglia in the brain
Hmm.
primarily, it spreads to the whole brain. But hemochromatosis, high iron also really damages your gut lining, and Parkinson's disease actually starts in your digestive lining.
Yeah.
So like the protein that is misfolded, it actually travels up your vagus nerve from your gut lining to your brain to
Yeah.
the basal ganglia. And so the gut issue is kind of setting the stage, and then the brain is just also kind of primed to have a problem. So it's multiple different parts here that
Yeah.
the hemochromatosis is driving the Parkinson's disease. Yeah.
Yeah, that's nutty. So I started to say earlier, because we talked about this before the podcast. Like, I had a neighbor um who had hemochromatosis. He was when I met him, maybe he was in his late 60s, early 70s, and he just passed away the summer of 2023. And it was, I mean, it was related. Well, talking to you, it was directly related, most likely, to the hemochromatosis. But in his case, he was a competitive cyclist his whole life, and had been dealing with crazy joint issues, and at least one, if not both, of his ankles had to be replaced. And he knew he had hemochromatosis, so he was going and getting regular, giving blood on a regular basis. But at the end of the day, what ended up being his undoing was that while he was in the hospital for one of these operations, he came in contact with the bug that causes flesh-eating disease, and that is ultimately what killed him. And you were saying that there's most definitely a connection there to the hemochromatosis that would have exacerbated the issue.
Yeah. So there's so many interesting parts to this story. One is he's a competitive cyclist, okay? Caucasian, I assume he's Caucasian,
Yeah.
competitive cyclist. Okay. So I think, based on what I've seen, I think that Caucasian athletes, or just athletes that have one hemochromatosis gene, are going to be better athletes for it. It's almost
Mm-hmm.
like this Goldilocks principle. Like, they
Yeah.
have the one gene, so they could go too high in iron, but they're also somewhat protected from going too low in iron. And when you are really athletic and really exercising hard, it's really the exercising hard piece,
Yeah.
you're more likely to become low in iron. And so this one hemochromatosis gene is kind of like a shield from that low iron situation.
Yeah. Yeah.
Um, and he could have had two. I wouldn't be surprised if he had two. But maybe at some point in time, like, that protective shield became a problem because the iron levels just kept creeping up. I
Mm-hmm.
don't know exactly what the timeline was, but what I see is often people, they go from being pretty good while they're competitive and really exercising a lot, and then they stop exercising as much, and in the later years after that, their iron levels really go high,
Yeah.
because they're not exercising as hard, which isn't driving down the levels of iron
Yeah.
as quickly. It's not that way for everybody because there's so many different environmental factors. Like, maybe they change their diet to eat more iron rich foods, or maybe they start
Mm-hmm.
taking a vitamin C supplement to increase that unintentionally increases iron absorption. I'm not really sure which case he was in, but I think that's an important part of the story. The important part of the story is the joint issues. Okay. So hemochromatosis destroys joints. Um,
Mm-hmm.
and being a chiropractor, like, I see so many people that come in with joint issues that it's just hemochromatosis. And
Really?
that's so frustrating to me, um, for so many different reasons. But it's very common. And that's one reason that I use so much curcumin in my practice, because if you have hemochromatosis and you have joint pain, then the curcumin's going to help decrease the inflammation and the joint pain while lowering the iron and helping to kind of pull the iron out of the tissues.
That's so interesting.
And
Yeah.
then, so he gets all these joint issues. He ends up going to surgery, which is totally avoidable. Like, had he been diagnosed and managed better, they could have avoided the joint issues, could have avoided the surgeries. And then he gets the surgeries, and the flesh eating bacteria, like, this is not a coincidence, okay? There could have been two people in the same room exposed to the same bacteria, and he's the guy who dies from it because he has high iron at that point in time, okay?
Mm-hmm.
Because when you have hemochromatosis, when you have high iron, you're more likely to die of flesh eating bacteria.
Literally.
Literally.
Like that specific bacteria.
Yes, I can't remember the name of it. I think it's like Vibrio vulnificus. But
Okay.
basically,
I'll take your word for it.
like if you ever get flesh-eating bacteria, you need to be checked for hemochromatosis. Okay, whether it's from surgery or in the ocean or whatever. And this is the same bacteria that can cause serious foodborne illnesses, which is why people that have hemochromatosis, uncontrolled, high iron, they are more likely to die of food poisoning. Like that bacteria, if they come into contact and get sick with that bacteria from eating uncooked seafood or whatever, then there's a 50% chance that they're going to die of that. Whereas, you feed that to somebody with normal iron levels and they might feel horrible, but they're not going to die from it. So, but all infections are more common in people with hemochromatosis because high iron is fertilizer for infections. Some infections
Bacteria.
more than
Yeah.
others.
Yeah. So it actually, that's what I had heard, is that the bacteria feeds on, like basically the iron feeds the bacteria, or the bacteria feed on iron, or
Almost all pathogens feed on iron. When you have hemochromatosis, you're more likely to have almost every pathogenic infection.
no
It's
kidding.
just some are worse than others. Yeah, whether it's Epstein-Barr virus or a parasite. Now, the exception to the rule is Borrelia, which causes Lyme disease.
Oh,
That feeds
so
off
there's a
of
silver lining.
manganese.
Okay.
That feeds off of manganese. So don't go take a bunch of manganese if you have Lyme disease. But almost every other pathogen feeds off of will thrive under conditions of high iron.
High iron. That's insane. Okay, so joint issues, higher chance of infections, and is a massive issue. So I'm sure you have millions of other stories and stuff we could talk about, but let's, just so people don't go chucking themselves off a bridge here, let's talk a little bit about what you can do about hemochromatosis, because there are things and I know his wife would tell me, like, he doesn't eat any red meat by the end. Like, he was, they had pretty much dialed in his diet as much as they could. And I don't know enough about his backstory to know if it had been controlled his whole life, or did he find out later in life? Like, I don't know anything about that. But let's talk about our audience and the ones that are sitting there going, oh my God, maybe I'm that person. What am I going to do about it, short of running around hooked up to, you can't bleed yourself dry. Are there lifestyle practices and different exercise? Obviously is one.
Yeah.
But I would think that it's got to be pretty rigorous exercise. You can't just go do a
Well,
little walk around the block.
okay, so like the more rigorous the exercise, the more it's going to decrease iron levels. But a lot of people that are like, if you're trying to prevent hemochromatosis, it's much easier to exercise intensely than if you already have hemochromatosis. If you already have hemochromatosis and you're trying to exercise, it's probably going to be a lot harder than it would be and will be once you get that condition under control. Often people just going through the early steps of starting to lower iron, whether it's through removing blood or the supplements or the diet or whatever, they will feel so much better and have so much more energy for exercise. Their heart rate variability will go up, their resting heart rate will go down, they can have more stamina just from starting to improve the hemochromatosis. So, like, I don't think if you're dealing with hemochromatosis, saying exercise to get it lower is a really great starting point. We all need to be exercising. It's not your first
line of defense.
Yeah. If you can remove blood, like removing blood is a valuable tool. Now, there are other tools that are not used like I think they should be used. But if you have hemochromatosis and you go to a hematologist, the main tool in their toolkit is blood removal. For better or worse, I would say for worse, they need more tools. And so the issue is that if you have that blood removal as your big tool and your only tool, then you end up causing people to become low in red blood cells and low in hemoglobin, and they actually become anemic while they have too much iron. And then you can't remove more blood until the red blood cells come back up and the hemoglobin comes back up. And then these people, they're like, I know my ferritin is still too high, but I can't get my iron levels lower until I can have more blood removed. Well, that's not fair. So what are some other things they can do to lower iron? Because this is a very manageable, treatable condition. Like, if you're going to have something, this is a great thing to have, because there's something you can do about it. And the other things you can do about it, you can certainly adjust your diet. And the most powerful thing is to decrease iron-rich foods. Like, the most iron absorbable foods are red meat, because that has not just a lot of iron in it, but very absorbable iron.
Yeah,
so
heme iron. Yeah.
Exactly. Whereas like spinach has iron in it, but it's not very absorbable. So you're not going to be getting a lot of iron out of it. You can even, increase calcium rich foods to kind of like bind to the iron. You can increase curcumin turmeric rich foods. You can start taking some of the supplements that I have in the Iron Curse protocols. So like curcumin, I've talked about multiple times. Silymarin, milk thistle, that also binds to iron. Alpha-lipoic acid, that binds to iron and has all of these. The nice thing about all of those is that they don't just bind to iron, but they also help to like protect you and heal up organs and parts of the body that are damaged from
Right, from
iron.
the oxidative stress.
Yeah.
You talk about resveratrol in the book also being...
Yeah. So
Right.
resveratrol is interesting because it doesn't actually affect the iron levels. So it's not going to like lower your iron levels, but it's the research that made me want to put it in there was the research about how resveratrol helps protect the heart from issues related to hemochromatosis, like having a heart attack, which is very common with hemochromatosis. Resveratrol is also really good for the brain. So that's why that's in there. And then there's other things like quercetin will decrease iron absorption because it increases hepcidin. So like that's cool because really low hepcidin is like the mechanism of action that's causing hemochromatosis in these people. So if you can take quercetin to decrease iron absorption, then you'll be absorbing less iron while simultaneously taking this quercetin that is an antioxidant, which is going to protect you. So, there's lots of different supplements like that. Not taking vitamin C, actually going to altitude can make things much worse. Like if you're living at altitude with hemochromatosis, it can create more damage than like if you're at sea level. Versus like also like let's say you fly a lot, like there's going to be more damage at altitude. Like if you're a pilot or like a flight attendant, there's going to be more damage from the hemochromatosis at altitude.
Is that because of oxidative stress and?
I can't remember exactly why. If I do know why, I'm afraid I would misspeak, so I can't remember.
Okay, so regardless, being at altitude is it compounds the issues of hemochromatosis.
Yeah.
Okay. Yeah. And then what about sauna? I think you mentioned sauna in the book as well.
Yeah.
Is sauna a good thing or?
Yeah. So sauna does decrease like iron because you kind of sweat a little bit out. Another thing I didn't include in the book that I just recently learned from a patient is castor oil packs. I actually had a patient who was dealing with chronically low iron and couldn't figure it out. And she was doing these daily castor oil abdominal packs for various reasons. And they had helped her tremendously. But an unknown side effect was that she was causing anemia, low iron. And so when I learned that, I was like, oh, people could use that. I haven't used that clinically, but like I talked to my colleague about it and she's going to use it on her 5-year-old as an experiment. It's not going to hurt you. Castor oil packs are safe. I mean,
they're great.
They might kind of, if you have loose stools, it could be from the castor oil packs. But that's another way to kind of help get the iron levels lower. That's not just, remove blood and take supplements and stuff like that.
Is there data behind the castor oil pack?
I haven't been able to find any hard data, but there is data behind castor oil decreasing iron levels.
There is. Well, because I'm just thinking like those sore joints, like you would do a castor oil pack for a
Yeah.
sore joint anyway. So how interesting would it be if not only is it soothing and decreasing the inflammation, but somehow
Yeah.
pulling
Yeah,
because
that's a really good point. I didn't think about the joints part. I was thinking more of like the organs. But um, there's certainly data about how castor oil can lower iron levels.
okay.
But I think that's data, if I remember correctly, based on like taking castor oil internally,
Yeah.
not necessarily transdermally. But I can tell you this girl, nothing, she could not get her iron levels up until she stopped doing those castor oil packs every day.
Really? That's remarkable.
She was like gonna have to get an iron infusion. It was
Like a blood
horrible.
infusion. That's crazy.
Yeah.
Okay, well, is there, oh, and actually, there's one other little tidbit in the book that I thought was really interesting, and that was that people with red hair have a higher propensity of carrying one or more of the HLA genes. Is that,
The
you
HFE,
said
yeah.
it,
So,
not
okay,
HLA. I don't know
it's
why I keep
okay.
having this
HLA is a big
HFE.
one too. You know,
Yeah,
the HLA is important, but we're talking
but
about
it's different.
HFE.
Not for
Yeah,
this.
it's okay. So that's an interesting story. Um, okay, the hemochromatosis genes originated in a Viking ancestor thousands of years ago in like northern European, Scandinavian area. And they really, whether it started in the UK or if it just landed in the UK and then you're on an island and you're having, you know, like incestuous relationships because you're on an island,
Mhm.
the hemochromatosis gene, while it is prolific throughout all of Northern Europe, it is particularly high in the United Kingdom, which, you know, England, Scotland, Ireland, and it is even out of all the United Kingdom areas, Ireland is the most high of the hemochromatosis genes. Um, over 60% of the Irish people have at least one hemochromatosis gene.
Wow, that's
Yeah.
huge.
And remember how I talked about like the worst genetic combination, the C282Y homozygous? They have the highest rate of that there. And, you know, what else is in the United Kingdom? A lot of redheaded people. You know, I think red hair is beautiful, and it doesn't, just because you have red hair doesn't mean that you are going to have high iron. It just means that you are more likely to have this hemochromatosis gene just because your ancestors lived in an area where you were more likely to have red hair, and the genes that they had would be more likely to have the hemochromatosis gene. Now, Ireland's an interesting little historical tangent. The Irish potato famine from a couple hundred years ago, that famine genetically bottlenecked the Irish people. It was really horrific what happened. Um, Basically, over 1 million people died during that decade-long event in Ireland,
Yeah.
and millions of people left. A lot of them came to America and Canada because they were trying to flee. And so the people who were strong enough to survive and strong enough to leave, they were more likely to have a hemochromatosis gene, because the people who did not have a hemochromatosis gene were more likely to die of low iron.
Oh, wow. No kidding.
And so,
Interesting.
yeah. And so after this genetic bottleneck, after this famine's over, it was like a decade long famine, which, um, if you go to Ireland and you call it a famine, they might get very upset with you. They call it a genocide because during that time, the Queen of England actually had orders to take away some of the food that they did have. So the potatoes died of blight, but then the queen would like not allow the fishermen to fish in their Irish waters, would take away some of the like food that they did have, the other vegetables and poultry and stuff. And it was in the perspective of the Irish people, it was a land grab and
Wow.
a power move. And so if you go to Ireland and you call it the Irish potato famine, you might get some stares. That's just kind of an interesting historical, fact.
Mm-hmm.
Call it whatever it is. I mean, a famine is where you don't have enough food, whether it's,
Yeah.
intentional,
People
it's more of
starve
a
to death.
genocide,
Yeah.
but
Yeah.
regardless, you don't have enough food. And so after this famine is over, there is an explosion of people with hemochromatosis in Ireland because they survived and they
Yeah.
survived and now they have iron and they're absorbing more iron. Now they're high in iron, one extreme to the other. And a lot of those people came over to Northern America, to North America, Canada, United States, Mexico, Central America. My receptionist, she's from Central America. She has a hemochromatosis gene. I see lots of people in Dallas that have moved there from South America, Central America, Mexico. A lot of hemochromatosis genes there too.
Mm-hmm.
And another fun fact that I'm just going to kind of say, and then if you're, however much time you have, it's fine. But if you see a hemochromatosis gene, don't just think Irish, also think celiac disease, because two totally different genes, but extremely common in the Irish population. So, like, I don't have a hemochromatosis gene, but I have a celiac gene. I'm very Irish, okay? My husband, he has two hemochromatosis genes, no celiac gene, very Irish. My daughter, hemochromatosis gene and celiac gene, she's very Irish. Okay. So
Mm-hmm.
both of these genes are very common in the Irish population, and you will see them commonly together, which creates a whole nother paradigm of like, does the celiac hide the hemochromatosis because you're not absorbing iron? And if you fix the celiac disease, does the iron go
Then will it?
high?
Yeah.
Yeah.
Because the last question I wanted to ask you really was, is there something that like in someone who's walking around with a hemochromatosis gene that's not expressing, is there something that can epigenetically trigger that gene on?
Well, it's not so much an epigenetic trigger on, it's more like what's happening is your environment changed to where maybe you're eating more red meat, causing you to get more iron? Maybe is your gut health better, causing you to absorb more iron?
Right.
Maybe is like your liver not as healthy, because if you have an unhealthy liver, then you're not going to make as much hepcidin. And then if you don't make as much hepcidin, you're going to absorb more iron, and it becomes this
Right.
vicious cycle. So
Right.
there's like so many different little things. I wouldn't call it like a flipping a switch. I would call it more of like kind of a gradual movement in that direction.
Yeah. Or you decide you're going to become carnivore for any number of reasons, and it's a perfect storm.
Yeah, or like maybe you were raised a vegan and then you start eating red meat, and like being a vegan, maybe the only reason
Works
like
for
you could
you.
survive
Yeah.
as a vegan is because you had a hemochromatosis gene. The people that
Mm-hmm.
I've seen that are like very long-term vegans, they have hemochromatosis genes often. Like me
Wow.
personally, I would die. I would die. I'm not kidding.
Yeah.
Like, it would, goodbye. But they can survive because they have this gene where they can absorb iron. And
That's
even
so
sometimes those vegans become low in iron and they have a hemochromatosis gene.
right. It can, well, sure, because in a vegan diet, you can be grossly deficient in iron.
And many other
Certainly in the
things. Yeah.
inabsorbable, yeah, and a bunch of other stuff. Well, this has been really interesting, Dr. Christy. This has been fascinating. So thank you so much. I mean, I can tell there's more information where that came from. And there's this big, beautiful book here. So why don't we tell people where they can find you, where they can find the Iron Curse book, it's a great book, guys. And it's what I really like about it is you just have so much practical information in here, right?
Thank
So
you.
number one, it's understanding what to look for and how to tell that if you have an issue with iron. And then there's the whole back half is really about what do you do about it? What are the supplements? What's the diet? What are the lifestyle issues? What are the different things you can do to manage it? Because to your point, it's a manageable issue. So, and I guess one last question would be, if if because you're not likely to test your kids when they're really young, but if you test as an adult, makes more sense. If both parents carry a copy of that gene or one of those three genes, it would probably be smart to then test a child.
I think it's smart to test kids regardless.
Mm.
But 100% if you or your husband or your spouse, whatever, has a hemochromatosis gene, get your kids checked. And there's a lot of direct to consumer companies that make it much easier to do
Yeah.
than like going through, because it's actually kind of in some cases hard to get some doctors to run the hemochromatosis genetic test
Oh yeah,
through
just there's so many
insurance.
good genetic tests out there right
Yeah.
now. I think you can just go run it. You can
Yeah.
do a panel like really easily.
Yeah.
Just
That's what I would recommend.
yeah.
Just go to direct to consumer, get a hemochromatosis genetic test. And the nice thing is that if you go direct to consumer, like you'll probably also find out if you have some other important genes too.
Sure.
And they won't just be checking for that one. But yeah, I mean, I personally think all Caucasians should be checked for the hemochromatosis genes, period. In
Mhm.
America, really everybody, because we're such like a melting pot. Um,
Mhm.
in the United Kingdom, the fact that they don't check for the hemochromatosis genes at birth is like mind-boggling to me, because they could save so much money if they just did genetic testing. So yeah, I mean, if I could go on, but yeah, if somebody wants to learn more about this, then ironcurse.com is a great reference because that has my book. And then I have an educational workshop where you can watch the first part of it for free. And that's, if you're interested in the iron stuff, then that's a good place to go to.
Yeah, well, it sounds like by the time this podcast comes out, this will be known, so people will know there's a platform for nurses to earn CEC, to get their CECs for renewing their licenses, that is going to be using podcasts as as an educational tool, as a way for them to earn their CECs. This would be a fascinating episode for them to
Oh,
listen to, because
yes.
you're talking about primary care practitioners who very often are the first line of defense. They're the people that are doing the intakes, the people that are listening to the patient. I think this will be a really interesting episode for them.
Oh, that's fascinating. Cool.
Yeah. So anyway, well, theironcurse.com, are you on social media at all? Do you
Yeah.
have Instagram, anything
Yes.
else?
I'm on Instagram, Facebook, TikTok, uh, Dr. Christy Sutton, and yeah, ironcurse.com.
Amazing. Thank you
Thank
so much
you.
for your time. This has been a pleasure and very eye-opening.
Thank you.